Okay, this is Caring Beyond Cure Perspectives of Pediatric Oncology Nurses on Palliative End of Life Care by Peter Scarperi and Dr. Meredith Mackenzie Greenlee. So, very little is known about nurses' attitudes towards and comfort with providing end of life care in pediatric oncology and how burnout and experience really affect nurses' attitudes in providing this care. As such, we decided to uh, describe the attitudes of and comfort with providing end of life care among senior nursing students, novice nurses, and experienced nurses, and examine the relationship between work experience, burnout, and how these sort of work with attitudes towards and comfort with providing end of life care. So, this is a descriptive comparative mixed method study, which, as said earlier, looked at the three different groups of nurses: student nurses, these are juniors entering their senior year, completing a Flynn Fellowship in Pediatric Oncology, novice nurses with 2 years or less of experience, and experienced nurses with 2 years or more. The collection process was twofold. The first being a questionnaire that collected demographics. We used the ProQual subscale for burnout and the FATCOD to measure attitudes towards providing end of life care. In addition, we also completed 10 qualitative interviews, 2 student nurses, 4 novice nurses, and 4 experienced nurses. We did the statistics and examined how the data related to the FATCOD score, that being the attitudes toward providing end of life care. All in all, age and burnout were associated with more poor attitudes toward providing end of life care, whereas education and experience were associated with more positive attitudes with providing end of life care. And regarding the questionnaire, the big question here is, did your undergraduate education include content on caring for the dying child and their family? It is notable that only 2 answered yes, it prepared me to provide end of life care, and that is 2 out of 37 total. Um, and the real nuances of this data are better explained through the qualitative data, that being the themes and sub-themes, uh, such as the role of the nurse, challenges of preparedness and training, benefits of the Flynn Fellowship, parent-team barriers, and the emotional impact of end-of-life care. The data reveals the complex relationship between nurses, parents, medical staff, and how challenging grasping end-of-life care, both emotionally and from a nursing process standpoint, can be very difficult. Therefore, addressing the need for more education and hands on training in pediatric palliative and end of life care is crucial to addressing this gap in knowledge. Furthermore, research should explore the role of burnout and compassion fatigue and how interdisciplinary conflict affects end of life care.